Okay, I'm just going to talk about the rollout of video link consultations during COVID-19. For those of you who aren't aware, what is a virtual consultation? This means that patients have the ability to speak to a medical professional and receive medical advice without the need to leave their own home. And this can be done either by telephone call or video link consultations. Virtual consultations have played a significant role during the current pandemic to keep our services open. And with the NHSE planning guidance for 2021 and also under BHRUT's no going back, this means that this method of seeing patients will continue into the future. But with video link consultations, these have provided additional benefits to telephone calls for both patients and staff, and they can be conducted on either smartphones, tablets, laptops or desktops, as long as you have a working camera and a microphone. With the COVID-19 pandemic, it became impossible to run our outpatient services the same model, and eventually all of our face-to-face services except 2-week waits and urgents were actually suspended. But even before this, traditional models of outpatient care were not always aligned to the needs of the patients. To ask patients to actually keep travelling to healthcare facilities, they could be sick or recovering. And so it was including long, stressful journeys for them and actually sitting and waited for a long time in crowded waiting areas. And we found this can lead to non-attendance or DNAs at outpatient appointments, which led to poor patient engagement, which led to poorer health outcomes and also increasing the use of ED for some of these patients. So with the implementation of virtual consultations, this has enabled the continuity of services during the COVID-19 pandemic, and especially for patients who are shielding or in high risk groups with the longer term conditions and patients who are unable to travel. It was keeping the patients safe, allowing services to continue to care for them while the outpatient clinics were suspended. Virtual consultations have allowed shielded staff and those in quarantine to conduct important outpatient consultations from home. In March 2020, NHS England provided Trusts in England excuse me, with the Attend Anywhere licences to be able to implement video link consultations. Attend Anywhere is a web-based video conferencing tool which is used to provide video consultations to patients and service users through virtual clinics known as waiting areas. So as you can see here, this is an example of a waiting area. Information would be sent to the patient with a unique link to them to be able to join the virtual waiting area, where the clinician would be able to click on the patient's name to actually start the video call. Within Attend Anywhere, there's an option to share the screen, so you could share test results, x-rays and other investigations. And you also have the ability for others to join the call, so either friends or family and carers, or even other clinicians to actually be able to have an MDT consultation with that patient. And there's also a chat function, so in case of hearing impairments, patients to actually be able to see the clinician. To actually implement this, to actually get it implemented within the trust, obviously we had to do a rapid rollout due to the COVID-19 pandemic. So we had to contact all the services providing outpatient services and actually provide training demonstrations for the platform, obviously socially distanced. And we had to do a rapid procurement and deployment of headphones and webcams to those consultants and clinicians who didn't have access to laptops. We created standard work to be able to set up the video link service and had to discuss with services what would be required as a minimum to actually have a smooth transition from face-to-face to video link consultations. We also worked with the training team to produce Attend Anywhere quick reference guides and also training videos that were uploaded to BEST, so clinicians could train themselves if they could not get access to one of our team. We also work very closely with the outpatients administration team to create clinic profiles that were dedicated to video link consultations, so we could provide NHSE with an accurate figure of how many video link consultations were actually happening within the trust. We also work with the services to ensure patient letters and information leaflets were applicable to their service, and also be able to upload those to Medway so we could easily send those out to the patients with all of the information they would require. And it also included information on what their opening hours would be on the platform, on the Attend Anywhere platform, and any additional information that they would like their particular patients to see. So to do this, we actually worked with services actually going live with video link consultations and created a standard operating procedure, which has been added to. And after testing and evaluation after the rollout, we've actually been amending that as we go along. We're now on draft 9. So this is also included creating the virtual waiting areas for each services on Attend Anywhere and providing all of the clinicians with training and login details. And to also achieve this, we had to work closely with the Careflow PAS development team to make sure that letters and patient information leaflets were available to the services. And also working with the communications team, we ensured all of the information that was required for services to log on to Attend Anywhere were actually uploaded to the Trust intranet page with easy access links to any of the training and documentation that needed to required. And we also made sure that the patient information leaflets that were uploaded to Attend Anywhere are amended within the Careflow PAS. Now, obviously, which patients are able to have a virtual consultation? The virtual consultations are suitable for most patients who do not need to have a physical examination, and particularly for follow-up patients. However, virtual consultations may not be suitable for some patients who, for example, are unable to communicate properly, have a disability or learning difficulties or autism, patients who lack capacity to make a decision, or patients where there may be safeguarding concerns, or if they're very thorough with complex needs. However, with some thought, some of these issues may be overcome. For example, with patients with hearing defects, obviously we can get interpreters and British Sign Languages to join the call, which has happened, especially for our audiology team, which has proven to be very successful. However, deciding which patients should be offered a virtual consultation, whether it be telephone or video link, it should be clinically led. So this is where triage is very, very important. However, there must be consideration when booking clinics, booking the virtual clinics around unequal access to video consultation due to some patients lacking in technical skills and the confidence to deal with digital technology, or having limited access to hardware. And equality and health inequalities impact assessment has now been conducted by NHSE, which is currently under review by the Trust. So obviously we'll take that into consideration going forward. But the benefits to our patients for virtual consultations: it saves the time and stress of travelling to and from the hospital, and the patient doesn't have to take time off from work. They can still hold the video consultation as long as they obviously tell their boss or their supervisor that they need to take a call. They can just go into a quiet space or area and still have their consultation with their clinician. So that means this patient spends less money travelling to and from, and also parking at the hospital if they're driving, which reduces the carbon footprint by reducing CO2 emissions as a result of reducing travel. And also the patient doesn't have to wait for their appointment in a really busy waiting area, which obviously reduces the risk of spreading infections, especially with the horrible COVID. So virtual consultations can reduce additional harm or risk to physical or mental health by leaving home or excessive travel. And as explained before, interpreters can join the virtual consultations too. So whether it be language line or British Sign Language, they can actually be booked by PALS in the normal way. Or on the other hand, the patient can also request that a relative of a friend or carer can join the call as well. And video link consultations add the benefit of providing visual cues to both the patient and the clinician. Sometimes it builds a better rapport and improves communication, which provides more reassurance to the patients. Increased eye contact and the ability to see the clinician can be more beneficial than just telephone consultations. But it also provides benefits to our clinicians as well. Again, before COVID hit, some clinicians were spending time travelling to different clinics at different hospital sites. Obviously, with Attend Anywhere, it's literally Attend Anywhere. They don't have to go anywhere, which will also enable them to work from their own home as well when needed. So it can improve work-life balance. And also with our therapies team, their feedback was that they had some of their staff who had been asked to isolate on several occasions, and it's actually they could still do their outpatient work from home. It also allows the clinicians to link up with their other professionals, whether it be in our organisation or, say, for example, with Bart's Health, to be able to run multidisciplinary meetings and their appointments if needed via a video link, which can also include the patient, friends, carers and family, and also interpreters if they need to. Because the Attend Anywhere system allows, I think it's about 10 people to join the same call. Also, it helps the clinicians more than a telephone call sometimes, as the patient will be able to hold their digital device over to either their wound to see how it is healing, or the clinician can ask the patient to walk across the room so they can see their gait, for example. So these facilities, at the moment, we're just trying to determine if it is decreasing the DNA rates as a result of offering patients flexibility for their consultations, but we're still reviewing that at the moment. And also whether or not we've conducted a couple of patient experience surveys, and so far the response has been very positive. So in summary, to date, over 11,500 consultations have been completed via Attend Anywhere, and over 45 of our services have come to use the platform. And you can see there the top 10 specialties out of the 45. And so virtual consultations have been shown to increase patient attendance rates, improve outcomes and provide more patient-centred care and improve patient satisfaction. So there's no travel, less time wasted, no money and no stress going to face-to-face appointments. So for virtual consultations, whether it be a telephone call or a video link consultation, they may not be suitable for some patients, and obviously we've got to take into consideration the impact on health equalities. With careful planning and clinical decision making, the use of video link consultations will enhance the service provided by BHRUT for both patients and staff. This will allow clinicians to be able to contact patients easily, with the ability to hold MDT consultations, eliminating the need for several separate consultations for the patient. And these are just a few quotes from some of our teams who have actually used the service. I will obviously hand round the slides for Katie to send round later, but thank you. Do you have any questions?